Welcome to Health System CIO's interview with Dr. Lee Schwamm, SVP, Chief Digital Health Officer, and Associate Dean of Digital Strategy and Transformation at Yale New Haven Health System and Yale School of Medicine. I'm Anthony Guerra, founder and editor-in-chief. Dr. Schwamm, thanks for joining me today.
Oh, it's my pleasure, Anthony.
All right, very good. You want to start off by telling me a little bit about your organization and your role?
Sure. I'm at Yale New Haven Health System and Yale School of Medicine based in Connecticut. It's a multi-hospital network consisting of a flagship academic medical center and then a variety of community hospitals, as well as ambulatory settings all around the state of Connecticut and a little bit into the state of Rhode Island. And I was brought here 2 years ago to really focus on digital transformation and to bring forward alternative care models that could help bring value to the health system, improve access for our patients, and overall improve the work experience of our providers.
All right, excellent. So I understand you've undertaken a project you call the Health AI Championship, an event. Well, it sounds like a competition of sorts. Um, Tell me, is this something that was in existence before you came? Is this your brainchild? What was your involvement with it? How was it put together? What's it all about? All this obviously the goal here is to tell your colleagues at other health systems so they may say, huh, that sounds interesting. That's something we might want to try doing. So I'll let you go
Yeah.
from there.
Well, so I think this is something that I established here. This is the first year of this program, and it is supported by a grant from the state of Connecticut that leverages state funds as well as some ARPA-H funding that was allocated to the state last year. The premise, Anthony, is that a lot of AI innovation in healthcare right now are vendors coming to healthcare systems with a tool they've built, usually by people who aren't in healthcare, to solve a problem that they perceive to be one in healthcare, which may or may not be an important problem in healthcare. I think the second challenge that we have is that of those solutions that are implemented in healthcare, they've largely been siloed in two domains: improving administrative or operational efficiencies, or diagnostic interpretation, particularly in radiology.
Mm-hmm.
And if you look at FDA approved AI algorithms, I think it's 85%,
Yeah.
something like that, or in radiology alone, right? And then there's like 5% or so in cardiovascular, and then the rest is just onesie twosies. So the premise of this is three things. Number one, we want to try to drive solutions based on actual important clinical problems, which means that healthcare systems need to be at the table helping to articulate the areas that entrepreneurs should be focusing on. Number two, I've seen in academic medicine a shift in the last several years where there used to be really intense and open collaboration around finding solutions for important healthcare problems. But because of the monetization in this space, particularly in the artificial intelligence space, it feels like health systems are increasingly focused on creating intellectual property that can be converted into startups or remuneration, with less of an emphasis on true system collaboration. So the second part of this is really to say, hey, as a state, as Connecticut, can we come together to do some interesting things as a state with the 6 health systems that exist in this state, recognizing that we still are in competition with each other broadly, but that we can find solutions that will make patient care better, clinical outcomes better, and that's better for everyone. And then the third part of this was really to seek a public-private partnership. So to talk to the state of Connecticut and say, hey, we want to make Connecticut a place where AI entrepreneurs want to be because of this fertile environment. And so that's really what we've accomplished with this competition. It is structured in it's like a layered onion. The centerpiece of this competition is a live pitch session that will happen on May 27th on the Yale campus. There are 12 finalists who'll be competing for 5 prizes. The top prize is $100,000 of investment in the product, plus an opportunity to validate the model in the Yale New Haven Health System data ecosystem. So that's I think, a very exciting prize. Not just the recognition, but that opportunity is really important. Um, but the second thing we're doing is we're wrapping around that a symposium with national speakers who'll be talking about very timely and somewhat controversial topics in AI governance and AI implementation. And we're very excited to have Shiv Rao, who's a colleague and a good friend of mine, who is the CEO and co-founder of Abridge, come and talk about thinking about what is it like from the front line to drive innovation in health systems with a being a third party vendor coming in from the outside.
All right, very good. Let's talk a little bit about this dynamic. It's kind of fascinating to me. Um, you mentioned that there's become an issue with where collaboration, and I'd like you to tell me who you mean when you say there was more collaboration and that has been sort of derailed by some of these initiatives, and we see them at a lot of large health systems that you talked about spinning off IP and having these, it gets a little strange where you have these non-for-profit health systems that are getting into these for-profit business lines. And you're saying that that dynamic can be problematic. And I'd like you to tell me a little bit more about what you mean by that.
Yeah, well, look, I think it's no secret that not-for-profit healthcare systems are in really significant financial challenging circumstances right now. So they have to diversify their revenue. They have to think about what assets they have that could be uh, where the value in those assets could be captured in a different way. So I understand and respect that, and that is part of my job, is to help figure out, how we can leverage these assets more effectively. But because of that, data and access to data has become a very protected asset. So health systems are protecting access to their data in ways that they didn't used to. And I think the idea of starting a company when I was first starting in medicine, it was a big barrier to entry. It was hard to get capital. Venture capital was really just starting to invest in healthcare. It was daunting. And most physicians didn't have an interest in derailing their academic career to go start a company, except a few folks who did a lot of basic laboratory research, drug development. Like there were some spots where people left to go start it. They found a molecule or they discovered a gene and they left to go start a company around it. But I think the difference is now that the barrier to starting a company is so low. I mean, the threshold is just so easy to break through. And the sunk cost infrastructure, especially when it comes to AI algorithms, is also quite low because you can essentially rent storage and compute on demand from lots of major vendors. And now with the foundation large language models available, you can build a company just by fine tuning a model and putting a middleware layer on top of it and delivering a service with it that before was unthinkable. So
Hmm.
I think all of that has lowered the barrier for individuals to think about starting a company with their idea rather than creating a research collaboration and writing some papers and getting academic advancement. So what
Ah,
I mean by that is there's a shift in the value opportunities for faculty, so that this is becoming a more attractive alternative, which is, hey, before I collaborate and share my ideas and focus on doing research, maybe I ought to see if I can actually squeeze some different kind of value out of this same idea. And I think it's a healthy tension, right? That's good. But at the same time, I think we want to not lose sight of the value and the benefits that accrue when academically entrepreneurially oriented academics work across health systems, across peer groups to create new ideas and new products.
So very interesting. So it's just the evolution of the environment, but there's some negative consequences, and there's not much to be done about it. It just kind of is what it is. But you're saying there's some unfortunate elements to the fact that what previously would have been shared as a paper, peer-reviewed paper, and people could have leveraged is now sort of walled off as IP because they see the potential. Let me at least say if I can make a run as a company with this, and maybe if I can't, then I'll publish and share. But if I can, I'm not sharing, and there's a downside to that dynamic.
I think so. And I think that's where health systems and particularly state governments need to create incentives to drive in the opposite direction.
Mm-hmm.
So I think this program is really good for Connecticut, for example, because it's bringing these leaders together and having them collaborate on creating this competition. We sourced, we put this call out a couple of months ago. The competition's in May. Um, and we were hoping for an average of 5 proposals each from the 6 health systems in Connecticut. So we thought we'd get, 30 proposals. We got 54, and 54 really interesting ideas. Some well advanced, algorithms already built and validated locally, looking to validate, more externally. Others, just a really good idea, but no actual prototype yet. So really across the spectrum of maturity. And I saw all the submissions, and they're really impressive. So I think it's going to be a very exciting event that will be really fun to be part of.
Mm-hmm.
Um, but I also think that it's a testimony to the trust in this fabric that we created, that these people were willing to share their ideas right in this competition. So there's an incentive in the competition to get some financial support and external data validation, and that's enough to overcome the inertia that I mentioned before of, well, maybe I shouldn't share it yet. Maybe it should be a company before I take it to, to have other people take a look at it.
All right, very good. So it sounds like I'm interested always in the decision points as you're designing something like this. So, from what you've said, it sounds like there are some steps here or sequence here or levels that you put this together and decision points again. So it sounds like there is a bit of a federal grant that came into play here that you'd received at one point. So that's a federal grant. And again, I don't know if that could be part of anyone else's formula for saying we're going to go forward with this. I don't know if that's something they could say, hey, we got to get this federal grant just like they did at Yale. But anyway, so you have the federal grant element, you have a joining or collaboration among the state health systems. So at some point in this process, you got together or somebody organized the discussion and said, you want in, you want out, you want part of this. And then there's conversations with the state of Connecticut, right? So the state of Connecticut's on board. There's a federal grant, and also it sounds like all the major health systems. I don't know if you had a line where you said if you are above this size, we want to talk to you. You can't talk to everybody, and I can talk to every clinic, but
Right. Well,
right.
these
So
were,
all these
yeah.
decision points. Take me through some of that.
Yeah, let me clarify first. Even though some of these dollars are federal dollars, they flow through the state. So we worked with
Okay.
the state. We didn't apply for a federal grant and then get the grant and then build the competition. We met with the state and we talked with them in a separate series of conversations about what the state could do. They went on a listening tour. What can we do to promote in the most effective way possible adoption of responsible AI in Connecticut? So our answer was you could do A, you could do B, you could do C. And by the way, you could also sponsor a competition, which we would be happy to host, to encourage this, collaboration. So I think that was the first thing. Getting the ear of someone who was interested in promoting this collaboration. Could be the state, could be a philanthropic donor, could be the network development teams of the different hospitals, but there was an agreement around that. The second is we went with health systems, not individual clinics, right? Or individual hospitals. So, and there are only six in the state of Connecticut. So we went to
Uh,
all six.
but you had to define what a health system is, right? So you came up with a definition and said, with this definition, there are six.
Yeah,
Go ahead.
exactly. And then it was a matter of, as you said before, reaching out to engage with our counterparts. Fortunately, the year before, we had explored a possibility of launching an AI accelerator in Connecticut. That did not end up happening, but as part of those explorations, we ended up meeting with several of our counterparts at the other health systems. So we had the beginnings of a conversation or a relationship to get these things started. But I will say the most challenging part of this, the barrier that we needed to break at the very beginning, was to create a structure that was transparent and fair for how the competition would be judged. So to do that, we recruited six completely independent, not affiliated judges to be the ones who would review the final proposals, select the finalists, and then select the winners at the live pitch. And I think um, that was a foundational opportunity to build trust. And I think that is why we were successful, because we identified these very knowledgeable, both academic health system innovation leaders, as well as folks from the venture community, um, to be a representative and independent panel. And that made everybody feel that this process was going to be fair. We also did very transparent um, assessment of the applications. So the way we organized it was every health system curated its own proposals. So inventors, investigators at each site submitted their ideas, and each site rank ordered their top 10 ideas. Some only had 3 or 4 ideas, some had more than 20 ideas, but everybody rank ordered theirs. We then figured out how many proposals we could actually accommodate. And we had allocated up to 5 proposals per health system, so up to 30 proposals. We then had each site, first, we gave everyone the opportunity to submit up to 5. Several had 5, several had less than 5. We took the unfilled slots and reallocated them to
Hmm.
ones that had more than 5. Again, one for one, not like, oh, you get 2 because you're bigger or you're smaller. It was just everyone had an equally representative vote. And we then took those, and everybody then of those hospital advisors were on a committee. They then had to read and rank the proposals from the other 5 systems. So each of us then ranked the proposals from the other 5 systems. We combined all of those scores, and that created a rank ordered list from 1 to 29.
Mm-hmm.
We then took that list and gave that to our independent panel. And we said, this is the rank ordering across all the judges within the health systems, but you should perform your own independent review. This is just informational for you. And we also highlighted in that list, this is the proposal that Hospital X thought was the best from its site. So
Mm-hmm.
they saw 6 highlighted elements that each health system thought was the best idea, and they factored that into their decision making. And they then produced the list of the 12 finalists that they would review for live pitches. Between now and May 27th, those individuals all have the opportunity to work with our Center for Healthcare Innovation at Yale New Haven Health System to perfect their pitches, to get some guidance on how to build a pitch deck, how to present in front of the judges, so that, again, we're offering the same level of support and experience for those investigators who haven't really done a live pitch before or don't have a lot of experience in this area. We're again trying to elevate their performance. And I think all of those factors
Mm-hmm.
put together made this a very appealing competition to participate in, and removed any sense that the results might be rigged, in favor of one health system or another.
So the six health systems are each able to submit a certain number of applications, and they're coming from where? They're coming from the public, from startups, or are they coming somehow from people who are already involved with that health system?
Exactly. Sorry. Thank you for
Yeah.
mentioning that so that I can reinforce that. To participate, the application had to have a primary sponsor at the health system who was an
Oh,
excuse me, an employee of that health system, and the funds go to the health system. So you could partner with a startup, but you had to show credible evidence that you have a meaningful relationship already. So you couldn't just have some Joe startup put in an application through Nuvance Health or Hartford or Yale. You had to show there was some meaningful collaboration. And that is because we very much wanted to make sure that these were going to be solutions that were driven by a genuine need in the health system, not what we see today, which is vendors just coming at us with solutions they've built totally independently.
yeah, that's really solves that problem. So as you were taking me through sort of the process, it struck me that it's very obviously very well thought out and uh, detailed. Uh, but it's certainly not impossible, right? I mean, this is just a thoughtful approach that can be replicated. Again, it's detailed. There's a lot of detail there, which there has to be. My question here is, you have six health systems involved in this. In terms of sequence and process, was it a process of you designing this whole thing and then sharing it, or was this somehow developed collaboratively? Like, what was the sequence? What works best here?
I think it's a combination. In work like this, there always needs to be accountability and someone has to get the work done.
Sure.
And so the team at Yale New Haven Health, and special shout out to Walter Lindop, who is the director in the Center for Healthcare Innovation at the health system, and Jamie Trumpler, who's our project manager. They worked very hard with me and with all the other hospital advisors. We created a framework, and then within that framework, we made collaborative decisions about how we're going to move forward. So the members of the other hospital teams felt, I would like to think, and they echoed in our conversations, they felt very much a part of the process. So they were able to provide advice. We made our decisions about how to allocate the number of proposals per site as a group. When we found that we didn't have 5 from each hospital system as a group, we decided to reallocate the available slots evenly across the other health systems. So I think you got to walk the walk. If you're trying to say that this is about collaboration, you have to walk the walk, and people have to have an opportunity to have some decision rights around the direction of the collaboration.
How do you make? I mean, does one, and I don't know if this came up, but does one veto like scuttle the initiative of, whatever the specific proposal is? So you have six entities. You said they all get equal voice. So I'm thinking of, the Senate versus the House of Representatives, the founding of
Hmm.
the country, the deciding, based on size, you have more weight
Yeah,
here, but right. So you're saying there's things we do want to do, things we don't want to do. What about the idea of one vote scuttling a proposal? Is that already any majority? Again, I'm getting probably too much into the weeds here, but this is how my mind works.
yeah.
Um,
I think for certain domains, I think having explicit parliamentary rules,
yeah,
effectively what you're talking about, rules of engagement is important. I think in a scenario like this, at least in academic health systems, things tend to move toward consensus. And
yeah,
I think if someone is being belligerent about an objection without grounds, that just, I guess I would say the collaborations don't tend to get started
uh-huh,
if that's the environment. I think here there was a recognition that there was a exciting but somewhat frail opportunity, right? We had to pull it together. We had to make something happen, and because the process, well, I think, was designed with fairness as its core principle, we succeeded. I think if we had said it was fair but had structured it in a way that all the decisions were already made and people were just being told to participate, or kind of take it or leave it, I think we would have had a very different outcome. So I think part of this is about building trust and building community.
That's awesome. That's great. We're almost out of time. I think my final question would be, let's say someone's listening to this or watching this and they go, that sounds great. I'm in Minnesota and I would really like to move forward with this. I love the dynamic of hinging it on someone from the health system having to be a sponsor because, as you said, you're solving a problem. Getting the state involved, obviously, you need the resources for the prize money. There's probably so many other logistics we could get into around the judging and people that need to be involved, legal representation. You know, you're talking about a state level contest that's got to be shored up legally speaking. You always have to assume, are we going to get sued? Somebody who thinks they deserve the prize money. You want to make sure you're all protected there. But your best piece of advice to someone who loves this idea and wants to know how to get started wherever they are.
I think it's about creating the right incentives and building that community. So I would say if this is of interest to you, reach out to your counterparts in the state, and then figure out who in your state legislature has an interest in supporting information technology, innovation, healthcare advancement, and get a meeting with them and talk about this as an opportunity to really promote responsible and effective implementation of AI in healthcare in the state. And then I think that, you could have spun this 10 different ways.
Right.
This is not like a magic formula. This was
Right.
just fair, transparent, collaborative. If you stick with those concepts, I think people will be excited to participate. And, you don't always have to offer prize money as a way to incentivize people to collaborate. And access to data or access to expertise can be just as valuable or more valuable than cash, quite frankly. So I would say think about the assets you can bring to bear and how it's like a charity auction, right?
Hmm.
You can give a weekend at your vacation home as a prize. You're not spending any money, but you're
Hmm.
making an asset available. So think about the equivalent of that weekend getaway. Like, what do you have in your health system or university that could serve as an incentive?
That's wonderful, Dr. Schwamm. I was a great conversation. I really appreciate it. I think this will be enjoyable for your colleagues, and I hope I can catch up with you again down the road.
Sounds great, Anthony. Have a wonderful day.
Thank you.